All right, and we should be live. Hi, everyone, and welcome back to another session with Dental Shadowers. Today, we're joined by Dr. Peterkin, who will be talking about family dentistry and her experience. Doctor, thanks so much for taking the time out of your busy schedule to connect with us. Please feel free to take it away whenever you're ready.
Thank you so much. I appreciate you guys for allowing me the opportunity to share. I think virtual shadowing is like really innovative, especially considering the times. And so it's awesome to be able to share with you all across the country at this point. So today I will be sharing a little bit about me as a family dentist here in Phoenix, Arizona. Let's see if I can move the screen. There we go. All right. So the topics of discussion today will basically be how I got to where I'm at today, a little bit about what I do in the office in the form of case presentations, and then any advice that I have for you guys as pre-dental students. And lastly, you can ask me anything. So how I got here today, it started off in Miami, Florida. My parents divorced and we moved out here to Arizona. And so, and moving here, of course, my mother was big on healthcare. So we established a dentist right away. And going to the dentist, I never had cavities and still haven't to this day. So I'm kind of a nerd, but cavity free. And so in having that bragging right above my brothers, I always enjoyed going to the dentist. And the hygienist that took care of me, she was very passionate about her job and educating and inspiring. So she asked me if I would be interested in hygiene because she knew that I was interested in healthcare. And I told her yes. And so I was, in my mind, set to pursue hygiene. But later on, closer to my senior year, she's like, okay, you are a scholar, you got a full scholarship to college, you should probably consider being a dentist. And I was like, oh, I don't want to go to school that long. She's like, but if you just go straight forward with that, you'd finish before you even know it. And so with that thought process, I moved forward in obtaining my degree in chemistry, pre-dental studies at Bethune-Cookman University in Daytona Beach, Florida. That is my alma mater. It's a historically Black college in that city. And so I'm there, I met my husband and a host of other friends who were also pursuing dentistry and or medicine. I applied to dental school in my fourth year, the summer leading up to my fourth year. But prior to doing that, I was a participant in the Summer Medical Dental Enrichment Program at University of Texas, Houston. And I was there to basically have 6 weeks where I was inundated with the lifestyle of a dental student and a medical student. I just wanted to solidify my idea that dentistry was for me and I wasn't going to, make the wrong decision. And so in doing so, I gained a lot of experience and just knew that that's what I wanted to do. So I applied the year after that to dental school to only 3 schools and interviewed at 2 of the schools and got rejected outright at one of the schools. And then the other one put me on the wait list. So of course I was devastated because obviously going to college on a full scholarship, I just thought I just had to, apply, take the DAT and be good. But there was so much more to the application process that I shortly found out about later in detail. So what I did instead, once I graduated from Bethune-Cookman University in 2010, I went ahead and applied to a master's in biomedical sciences program at Midwestern University. The funny story about that, though, was that a friend of mine basically was applying to medical school and she had a similar circumstance as me. So she said, you should apply to Western University's program in California. So I kept looking for it online and I could not find it. The only thing that came up was Midwestern because I was here in Arizona. And so in applying that was like totally life-changing for me because thereafter, I just took the DAT one more time, applied, and I got accepted into 3 schools, but I chose to go to Midwestern University, Illinois, because they were the first school that I was accepted into. And I had the unique opportunity to become a part of the inaugural class. So I started my dental journey there. I went to Midwestern University in Illinois. I was a part of the College of Dental Medicine Illinois inaugural class of 2015. And just in the middle of that time, I got engaged to my husband, who was my college sweetheart from Bethune-Cookman University. And before I could finish school, just before actually the first quarter of my sophomore year in dental school, we got married. So I started school as Jessica Denise Brayton, and then I graduated as Dr. Jessica Brayton Peterkin. So today I am a wife to my college sweetheart. Together we have a 4-year-old son and an 8-year-old puppy, and I am now a dentist and a practice owner. I did want to share a little bit about Midwestern University College of Dental Medicine, Illinois, because being a part of the inaugural class gave me an opportunity to basically spearhead all the organizations and just building the culture of the university. So I was the founder of Give Kids a Smile program. I received an Exceptional Student Leadership Award from the International College of Dentists and Procter & Gamble upon graduation. I also did externships during my summer breaks at the Indian Health Service. Basically, I went to various reservations across the country and provide dental care services. And then I also spearheaded Special Olympics and a host of other things, but I really was involved in my campus and even served as the very first vice president of student council. So upon graduating in 2015, of course, um, my husband, I thought we were going to go back to Florida, but my husband wanted to come to Arizona, which I just so happened to have my mother here and my mother's parents and, extended relatives. So I ended up moving here as he pursued his PhD at Arizona State University. And so I moved here, started practicing as an associate for corporate dental office. I did that for about a year before I had my son, and then I took 4 months off from maternity leave and soon realized that I wanted a little bit change of pace in my career. So I ended up going over to private practice, and I did that for a year, and that didn't work out. So then I went over to pediatric dentistry for several years and gained a lot of pediatric experience, which further solidified my interest in becoming a family dentist. And so after about 3 to 4 years of participating as an associate dentist in various practices across the valley, including in the public health sector as well as cosmetic dentistry, I ended up going over to start my own practice. So while I was working in public health, I was putting my line together to make sure that I could go straight towards having a private practice. And so you can see on the left, that's my family. That's me and my husband and our 4-year-old son that was actually taken 2 weeks ago. And then our little dog, he's so in love with my husband. So that's why he's not looking at the camera. But and then to the right is my team. We have my office manager, hygienist, 2 assistants, and then I also teach students at dental assisting programs. So they come and do externships in my office. And so that's who's in the picture as well. So this is a quick video. Please let me know if you can hear it, John. I'm not sure, so I'm gonna try my best, but I don't know. Let's see. Can you hear?
Y'all, great shit, family, dental, yeah.
Girl boss.
Yeah.
Girl boss.
Teamwork.
Come on, man. We're trying to teach them about how to brush and floss their teeth. You know what I'm saying?
Every day we brushing them. 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 Clean them good.
Every day. With that floss.
Hey,
Brush them real good.
check it. Brush them real hard.
Brush them real hard.
Brush them real hard. Brush them real hard.
Get up in them guns. Get up in them guns. Every day we brushing.
Brush your teeth twice a day to keep the cavities away.
Yeah, we brushing them.
I love it. You can really see the team camaraderie.
Yeah, so when we first started my practice, we had some downtime in the beginning. So we used to do a lot of TikTok videos and create music videos and various parodies. And so we had quite a bit of fun. And that's actually how I built my practice. A lot of people start their practice by, getting out another huge loan. Dental school is already expensive as it is, and I just did not want to take that commitment. And so I decided to go an untraditional route in starting my practice. And what I did is I essentially worked with a real estate agent who basically looked for buildings that were already pre-plumbed and built out for dental offices. I didn't know that was a thing, but I did ask him to help me figure out how I can make my practice be possible without spending all that money. And so he found several offices locations for me. And reason why there would be offices where they were previously built out and no longer are occupied is because there would be a dentist who retired and sold his practice to someone who already had another location, or it could be where an office merged with some other office, or an office that moved and they're just looking for another tenant to occupy that space. And so I happened upon several locations, but ultimately ended up at where I'm at currently, 59 East Lexington Avenue in Phoenix, Arizona. And it's like a prime real estate. That building was essentially a dental office for about 35 years prior to me moving in there. The dentist, he was just seeing family and friends there. He owned the building outright. He actually used to live there and converted a house into a dental office. And so when I got the keys from him, I was introduced to him by that broker or that real estate agent, and that's how the relationship started. So I had to completely explain the cost of a startup, and basically still had a startup without the initial pricing that most people would have with office in that similar category. So with having a startup, I was able to outright just purchase certain equipment and supplies and just create an office. And so my schedule has changed a million times over the past. My office has been existing for the past 2 years. And my schedule has changed quite a bit over the past 2 years because just basically gauging the area that I was practicing in. I am near the downtown area, and a lot of people do not like to drive in traffic. And so I've done things like working Tuesday through Saturday. I've worked, half days on various other days throughout the week. I've also worked on Mondays previously, but I realized downtown people just want to get from over there. And so what I do is I alternate Friday schedule, and then I work Tuesday through Thursday, and Wednesdays I have a half day. The reason why I have a half day on Wednesdays is because people would not show up to their appointments in the afternoon. And so I took it upon myself to just go ahead and truncate the schedule and then use that time to train my staff and educate them, and then do any continuing education courses such as anything related to dentistry and or lunch and learns, as well as CPR training and that sort of thing. So that is my schedule. And it works perfectly as a mother too. But as you guys know, I am a family dentist. Family dentistry is basically concerned with taking care of dental needs for the duration of a lifetime. So various stages of life, people have unique needs. So obviously a baby is starting to teeth, they're starting to develop teeth. I know how to address that. A young child may, hit their teeth because they are a little clumsy on their feet while they're learning how to walk as a toddler. I know how to deal with an emergency like that. When they have mixed dentition and they're a young child in the early elementary school, they have adult teeth and children's teeth. I know how to manage that stage of life, as well as teenagers who are starting to have full adult dentition, but drink a lot of soda and Gatorade and things like that. I know how to deal with that, and so on and so forth, all the way through the elderly community. I know how to deal with their unique dental needs. And so being a family dentist is basically just allowing me to be able to practice dentistry and not discriminate against the age of patients that I see. And so I see ages 0, 100, and everything in between. And I'm able to effectively take care of all of their dental needs. In my office, being a family dentist, I see a huge range of chief complaints from patients, anything from toothaches to over-retained teeth in a young child to teething issues, even developmental concerns that parents may have. Of course, kids as well as adults have infections and things like that, anything related to trauma and emergencies. But essentially, this list is not exhaustive of everything that I do, but these are the things I see most frequently. And so coming into the office as a new patient, most of my patients have to basically just relinquish their desire to come and order dentistry, because I don't believe in that. I'm a comprehensive dentist, and I find that it is very important for me to be able to see exactly what's going on in the full scheme of things so that I can treat accordingly and not just go tooth by tooth. And so if someone calls my office and say, hey, I want to come in for a cleaning and an exam, typically my front office and back office are trained to inform the patient that Dr. Peterkin believes holistically that dentistry is healthcare. And because of that, we have a specific protocol in which you can create an appointment. Are you in pain, or do you have an infection currently? If the patient says no, then we move on with the next thing. If they say yes, then we schedule an emergency visit. If they say no, we let them know that your first visit will not be a cleaning. It will be a comprehensive evaluation, and that will include a full mouth series of x-rays or panoramic x-rays, a comprehensive oral evaluation, including periodontal probing depths. We will also do oral cancer screening, a head and neck exam, tooth by tooth document what work you've had done, any existing restorations, and assess the integrity of that as well. And then look at what findings we find. If the teeth are, shifted, if you have an overbite, we check your overjet, we look at cross bites, we look at midline, we look at all the aesthetics things as well, and then we come up with a comprehensive treatment plan. I would say most people who come to my office after they hear that, they are intrigued right away, because a lot of dentists tend to not do that as much. And so it tends to help do a lot of internal marketing, because people come in and they're like, oh, I've never had a dentist do this. All dentists are trained to do that, but dentistry sometimes is a little bit more tricky when you have a lot of patients and not enough time. And so sometimes dentists cut out that portion. But for me, as for me in my practice, I like to use that initial visit to see if that patient is a right fit for my practice and see exactly what's going on based on their chief complaint. So after we do the comprehensive evaluation, I am looking at what their needs are. And I have a whole armamentarium of different procedures that I'm able to perform in my office, because once again, I am a family dentist, so I can do all pediatric dentistry services. I do not do sedation in office with the pediatric patients, but I do use nitrous oxide. For the geriatric patients, they have a ton of needs: full mouth rehabilitation, dentures. Some of them are partially or fully edentulous, meaning that they have missing teeth, and so we're looking for ways to replace that. Or sometimes they have broken down crowns or fillings that they've had for many years, and I need to replace that as well. I also do a host of restorative dentistry for patients of all ages, including children. But if you look at both lists, you can see that there's some crossover and that there's some fillings. SSCs and pediatrics is stainless steel crowns. So there's still crowns that we do for pediatric patients. But with adults, we don't use stainless steel. We use porcelain or, zirconia. I also do bridges for adults. They also have a host of periodontics that we do as well. And then I also perform cosmetic services such as teeth whitening and veneers. But I'm pretty comprehensive in my approach. The only thing I don't like doing is endodontics, particularly molar endo. So my list there is is non-existent. I only do anterior and bicuspids. And so I will typically refer out for molar endo, and I do a lot of extractions. A fun fact about me is that when I went to dental school, just before I applied, I wanted to be an oral surgeon. So that's what I went to school for. But then when I finished, I had an opportunity to learn a lot more about oral surgery and did an externship for several weeks at the Cook County Hospital in Chicago. And I got a lot of oral surgery experience. And therefore, I do a lot of my extractions in office, non-surgical and surgical, as well as wisdom teeth extractions. So I'm going to go ahead and get into case studies. I hope you guys are still listening in and that I'm not boring you. I just wanted to set the foundation about who I am and what I do. And so without further ado, here's some cases to kind of intrigue you and see a day in the life of what I do throughout the day. As I mentioned before, I do a lot of extractions. So a lot of these cases will have extractions involved. Some of the extractions are non-surgical and some of them are surgical. So this patient walks into the office. She's an 86-year-old African-American female, and she informed me that her teeth are loose. And so we took a full mouth series of x-rays. As I mentioned before, for comprehensive evaluation, we make sure that we look at everything. And as you can see on these x-rays, if you're looking at bone, if you were to trace the bone all the way across, the patient has lost a significant amount of bone around all of her teeth. This is pretty consistent with her age, being that she's 86 years old, but there's a lot of bone loss. Some of these areas are just not so much age, more so just hygiene. So if you notice that she just has a lot of bone loss. So these teeth down here are moving because they're only holding in by a thread. A lot of the teeth in the front are moving and in the back are moving. So I needed to come up with a plan to address her need of the fact that she came in because her teeth are loose. Obviously, she does not like that. So in doing so, I have to come up with how I am going to treat this. You can't treat it one tooth at a time because, pretty much the majority of her teeth are loose. So in treatment planning, I'm looking at the full arch, upper and lower, as well as her bite. And I see that here she has traumatic occlusion. Her teeth are hitting really hard. So not only does she have a weakened periodontium, which is the bone and gum tissue due to periodontal disease and age, she also has traumatic occlusion, which is further intensifying that presentation. So that's why she has so much bone loss. That's why her teeth are in the condition that they are. So if you notice, she also has tartar and things like that as well. And it's extensive. So in treatment planning for this patient, I needed to look at what her goals were. And her biggest goals were to be able to smile, to not have any more loose teeth, to no longer be in pain. She did not want to have her dentures or partials be really loose in her mouth. She didn't want them to fall off or cause her to gag or not be able to chew. And she wanted to get rid of infections and replace teeth without implants. And so in treatment planning, I'm looking at all of her options. One of the options is always do nothing. But obviously she wants me to do something, that's why she's there. And so we could extract the teeth that have a significant amount of bone loss or decay, which would render them with a hopeless prognosis. Or we could extract all her teeth and replace missing teeth with either a partial or a denture, depending upon which of those options we choose. So for this patient, she chose to extract only the hopeless dentition and use a denture with precision attachments to help to hold the dentures in with the remaining teeth that did not have bone loss. And so I extracted 16 teeth. This was actually last week that I did this, but I extracted 16 teeth. I arranged them in that photograph in the position that they were in when I extracted them. So you can see that I have 2 maxillary molars, 2 mandibular molars, and then a host of canines and incisors, as well as a bicuspid here. But yeah, I did all those extractions in one day, blocked out a couple hours for her to get that taken care of, and then delivered the denture. This was her before with the traumatic conclusion. This is her after. She was having a really hard time with biting down because she was numb. So this was immediate, the same day that I delivered that denture. Patient is currently in the healing phase with an immediate denture delivery. How immediate dentures work is that we take an impression before we extract the teeth. The laboratory creates the denture based on what they think the bone will look like once we extract. And then on the day of extraction, we deliver those dentures. So sometimes they can fit a little wonky. We have to go back in and adjust them more, do relines and things like that to help them to stick more. The good thing for her though is that we kept a few teeth that were exhibiting no more than class 1 mobility and used that to help anchor those in. And then because they have precision attachments, they can be easily converted later on in life to a complete denture. But as I mentioned before, she's 86 years old. I just wanted to make sure that we got rid of infection, keep her healthy, and fulfill her wish of being able to chew without the dentures coming out. So after that visit, of course, we need to adjust her denture to fit once the gum tissue heals and the bone. We also need to make sure that we adjust to remove any sore or reduce any sores that she may have due to the denture not fitting properly, and then help her learn how to speak and chew, and then teach her how to use it properly. So we are currently in this phase. She does have an appointment coming up this week, I believe tomorrow, and we will continue on with the remaining portion of her treatment plan. All right, hope you guys like that. That one is a pretty simple extraction case. This one is a little more complicated. She needs extractions too, but she's a younger person. She's a 32-year-old Caucasian female. She presented with the initial complaint of a loose crown. And so looking at her x-rays, there's a significant amount of things we have to tackle. If you look on the upper left-hand side of her mouth, she's missing teeth in the posterior. She has a lingual bar here with some decay. We have an implant here. This patient also informed me that she went to Mexico to get her work done. And unfortunately, some of the work that was done started to fail. And so because of that, we had to result in extracting teeth. I always tell patients and students when I'm teaching them, and when they come shadow in the office, as well as dental assistants, is that in dentistry, we're looking at five phases of treatment. The first phase is to get rid of pain. That's phase 0. Then phase 1 is to address any disease, cavities, things like that. The phase 2 is to rehabilitate and replace missing teeth, make sure there's no traumatic occlusion, things like that. The third is to make sure that we do any cosmetic things that patient may be interested in. And then the fourth is just to keep them on recare. Well, each tooth has about 5 lives. You can do a sealant to prevent a cavity. You can do a filling to address a smaller cavity, a crown to address a larger cavity, a root canal to address a deep cavity, and then lastly, an extraction. So teeth have essentially 5 lives. And if you're not careful with how you manage the third life that the tooth has, essentially you're forced to either get a root canal, and if you've already had a root canal and you don't take care of it, you're gonna have to extract those teeth. So if you're looking at the x-rays here, you can see that she has some gaps, some openings in those root canal teeth, we had to extract quite a bit of these. All throughout those crowns and things that she got done out of the country, they started to fail. And so unfortunately, we had to do a significant amount of work. We are not through yet. We really had some complications with the first phase of treatment. And so she's currently still in temps, but I will show you what we did so far. This is an extraoral photos, the upper arch, lower arch, and her smile. So as you can see here, this is the implant crown here. This is another crown that she cemented on with something else. And it's just a lot going on here. She had an implant here that failed previously as well. So we had to, she had that removed before. And so now this is what she was left with. You can also see some gingival decay, some root caries, and then you can see that lingual bar here. In treatment planning her, I'm looking at her goals again. She wants to be able to smile without having any missing teeth. She doesn't want any more loose teeth, no pain. She doesn't want to wear dentures or partials. I don't blame her. She's so young. I would not recommend that for a young person. And she also wants to get rid of infection. And so again, our treatment options include to do nothing, and then also to extract dentition with hopeless prognosis. So anything that's broken down that so far to the point where we can't save it, or anything that's super loose that we can't save. And then from there, get rid of any decay that she may have and restore that dentition by way of crowns, bridges, things like that. And then also to replace missing teeth with the same thing. So phase one, maxilla, if you can look closely, you see here, there's the implant. So we did take that implant out. I am not Houdini. I am not an oral surgeon by far. So under normal circumstances, I would not have been able to remove that implant. However, she had so much infection there that it was loose. And so I just retrieved that. The decay, obviously, I did show you on the x-ray that the crowns were undermined. And so that's why the crowns came off and the tooth broke, but I did remove everything. I extracted tooth number 6. The implant number 7, extracted tooth number 8 and number 9. They broke off because there was so much decay. I did place restorable sutures in there. So there's some stitches underneath there that is with chromic gut. And so the body will basically break that down over time. And then I put in a temporary bridge that goes from tooth number 4 to number 13. So if you're familiar with tooth anatomy, number 4 is a first bicuspid, or excuse me, a second bicuspid on the upper right-hand side. Number 13 is the second bicuspid on the left-hand side. And so we went cross-arch bridge for stability due to the number of teeth that were extracted. She did not want to do implant, and I think that she would have been a long-term rehabilitative implant case with a lot of bone grafting because of the amount of bone loss that she did have. But we did select to extract the hopeless dentition and then use a multi-unit bridge for restorative. So this is a temp that we had made from the laboratory. This is what she had before. Underneath here, you can kind of see the sutures that we have there. It was a lot of swelling, a lot of discomfort. We are about 6 weeks out since that was done. And so now we're ready to take these off. This has healed significantly. She ended up, in the meantime, while we were waiting for this to heal, she went to go get a root canal for one of the posterior teeth, which is good because when we finally deliver the bridge for front, we don't want those back teeth to be in a condition to where it won't withstand her chewing forces. We want to make sure we use those back teeth to support her bite. And so that's what we will be doing next. But this is just her temporary that we had in the interim. And this is what she had before. So after this, like I said before, we're taking the impression for the permanent zirconia Emax hybrid bridge. I chose to use Emax because that's cosmetic, zirconia because she clenches her teeth, and we want to make sure we support her bite without her breaking things. So the back will also be restored with zirconia. We also need to remove the rest of the decay that she has and restore. And if there's any type of root canals that she needs in the posterior, particularly, we would get those done as well. And then finish the full mouth rehabilitation and then use an occlusal guard or a night guard or a bite guard to help protect her bite. All right, moving on to case number 3. I have 5 cases, so if I'm moving too fast, please let me know. This one is a limited evaluation. This patient is an 8-year-old African-American male. He is already a patient of record, which is why we have his full x-rays here. But he came in afterwards. This was like a couple months later. So he came in April. Those lower anterior teeth were getting loose, but they started causing problems and they weren't moving anymore. And so as those adult dentitions started to come in, his parents started saying he had shark teeth. So he came in that day saying, "I have shark teeth, Dr. Peterkin." And I'm like, "Okay, bud, let's get this taken care of." So we evaluated what was going on, and preoperatively, as you can see here, we have a significant amount of eruption of the adult dentition behind the pediatric dentition, or the primary teeth. And so what's happening is that typically the adult dentition or the succedaneous teeth erupt lingual to the baby teeth. But because they erupted in this pattern where they're not directly behind it, it was unable to push these forward. And because of that, what ended up happening is that the roots were not resorbed. So we extracted, these are teeth numbers O and P, this is 24 and 25. We extracted tooth number O, and then we subsequently extracted tooth number P, and he was perfectly fine with remaining 24 and 25. So I'll show you kind of what the extraction site looks like. But usually when you extract a baby tooth, especially posteriorly, once you remove the baby tooth out, you would see the adult tooth underneath. But in this situation, because of the way his teeth erupted, it's way behind. So over time, postoperatively, he would just need to make sure that either he needs to go to orthodontics, or we always do the popsicle stick recommendation where we have the child bite on a popsicle stick to help lingualize these teeth. And so that is it with that one. All right, moving on to case number 4. This is a 22-year-old African-American female. She said that she had pain on the top and the back gums. The first thing I saw was this here. I'm like, what in the world is that? And so you can also notice that this tooth is super erupted. This is her normal bite all the way across here, but this is her wisdom tooth that's grown significantly. When we extracted it, we found that there was a cyst there. So, or enamel pearl, I'm not sure which one it is. I didn't really look at it too much, but whether or not it was soft or hard, but this was pretty interesting to see that this little lump is actually on the tooth. And another tooth on the other side, which is number 16, was a wisdom tooth. It was decaying, so we extracted that as well, same day. Pretty cool. All right, I think this is the last one. This one is a comprehensive case, patient of record, but we're in phase 1 treatment, just like the other young lady I told you guys about. This one is a 62-year-old African-American female. She said her front tooth is loose. She had significant amount of pathology. As you can see, there is a radiolucency here next to this tooth that's been root canaled. There's also resorption of the tip or the apex of the actual tooth. So normal apex is kind of conical. This is like blunted, so that obviously looks like there's some pathology going on there. If you look here, there's some tartar there as well, tartar here, all the way throughout her mouth. She had a significant amount of tartar, and so she definitely needs scaling and root planing for that. But because of her front tooth being loose, you kind of just have to give your patients the bone so that you can get them to see the bigger picture, but ultimately satisfy what they came in for. Excuse me. So we did the comprehensive evaluation. This is the first thing she wanted to address. So I told her that the compromise would be I would extract the tooth, prep, and do whatever we needed to do to help her. But she would be in temps, whatever decision she decided, until she got her scaling and root planing done. So she just got that done last week as well. In treatment planning that, sorry, I'm moving too fast. In treatment planning that, the patient wanted to be able to smile, to have no loose teeth, to have no pain, to not have to wear a partial. She also did not want an implant, and she wanted to get rid of infection. We prescribed antibiotics for her and went over her treatment options, which was to do nothing, to extract tooth number 24 with the hopeless prognosis. That was the tooth that had all that bone loss and resorption right next to it. We can replace the missing tooth with a bridge, since she did not want a partial or an implant. And in addition to that, we needed to restore the remaining dentition comprehensively, as well as make sure that her gum tissue and bone was healthy. So this is how we proceeded with that preoperatively. The tooth in question is this one here. The remaining 2 teeth next to it, tooth number, excuse me, I put 24, so I guess it's number 23. But that one is the one that's in question here. So we went over and we prepped the bridge from tooth number 23 to 25. Yeah, it is number 24. Sorry, I don't know why I'm losing my face here. But we did the bridge from tooth number 23 to 25. I prepped the teeth. And then after we did that, we planned for extraction same day. So I prepped it, I did the extraction, and then we made a temporary bridge to go from tooth number 23 to tooth number 25. And you can see that one here. Oh, my bad, here we go. And there it is. And this is not, oh, that was tooth number 24. But this is the bridge temp that my assistant made. I took that picture before I stepped out of the room, but normally when you place a temp, we clean all of that temp cement off of there and the patient walks out happy. She doesn't have to go without having a tooth any of the days, even though we did the extraction same day. So what's next? We take an impression for the permanent zirconia Emax hybrid bridge. We get rid of all of the rest of the cavities, like I said before, make sure that she has her root canals done if she needs them in the posterior, and then get her mouth rehabilitated and do a occlusal guard for protection because she does also have a parafunctional habit of clenching. So I'm done with my case presentations, but I did want to quickly show you some other quick cases here. None of these cases were quick, except the one on the far right, but I just wanted to show you a brief before and after. The patient on the left side, she came in, she had existing crowns that were breaking down, and she wanted to restore her bite and wanted everything to look pretty again. So we did the 6 crowns here. She wanted a bleaching shade because she's planning on whitening all her teeth. She's into all of the aesthetics and that sort of thing. So she was very happy with that result. This patient was one of my patients from my nonprofit. He came in with advanced periodontal disease. As you can see, his teeth are very long because he's lost a lot of bone and gum tissue around it. He has a gummy smile. So we restored his gummy smile with a denture. This patient here, he came in with he drinks a lot of Mountain Dew, soda, that sort of thing. And so he had a lot of decay at the gum line, especially on the upper. So he didn't want implants because he's very afraid of the dentist. He was extremely afraid to come to the office. He had to be sedated to even come for his cleaning and his exam. So it was very difficult to get anything done, especially with advanced dentistry. So we opted for partials for him based on his treatment needs, and his results came out pretty good. He's also, after he did that, he went ahead and got his cleaning and that sort of thing. And so he's currently still coming to the office a year later. So I'm very proud of that. And then this patient, it was a pretty quick case. She came in wanting to fix this crown in the front because it was a composite crown done to fix her peglateral tooth, which is basically like a really small lateral incisor. And she had composite placed over it, but it started decaying pretty quickly. So I replaced it with a crown and letting her know that she needed to crown the other side, but she was very happy with that result as well, because she no longer has a brown tooth in the front. But outside of dentistry, in the office, we do a lot of stuff in the community. I'm very big on reaching out and helping those who are in need. And so in addition to Brayton Family Dental, which is my private practice, I do have a subsection nonprofit called Ministry of Dentistry Incorporated. It is a 501c3 organization designed to provide care to the less fortunate and the underserved populations. And so I do charity work where I provide free dental care services comprehensively to various patients. And I'm very grateful to be able to give back in that way because I know what it's like to not have insurance, to be able to get your dental needs covered and treated. And I see so many patients in that position. I do treat the underserved community. I have a lot of minority patients. Being a minority dentist, it is very important to have representation. And a lot of times studies have shown that people are more apt to accept and comply with treatment if they see a doctor who looks like them. So I'm very big on, helping the community and the underserved. And so some of these pictures, this was Halloween 2019. Me and my 2 assistants dressed up as Wizard of Oz. The front office was so boring. They didn't want to dress up with us. And then this was when I did a Mission of Mercy with my lead assistant. We did a program at one of the schools. You can see me right here and a couple of my assistants and front office personnel at the school. The school actually was a school that has a lot of refugees. So that was really cool to be there. I don't know why this keeps happening. This was one of my patients. We celebrated his birthday by buying him some balloons and delivering his prosthetic that day. And so he came in on his birthday, was so excited. And so we surprised him with some balloons and a card. This was another one of the outreach projects that I had done when I first started my practice. at a preschool. And so that was really fun. And then, we have a lot of spirit days. We do a lot of fun stuff in the office, contests and different challenges and things like that. Of course, you guys saw my video earlier. And then we do go to conferences. Being that I opened in 2019, I only had a couple of months before the pandemic started, but we did definitely start off with a bang when it comes to our company culture and how we connect with one another and our community. And we actually went to New Orleans, and I took 2 of my assistants to New Orleans with me to a dental conference. In addition to that, I do tooth talks regularly. I started a YouTube channel back when I was in dental school, documenting my journey to becoming a dentist and also answering questions to breed dental students. And so I still have that going, as well as on my practice page, we do weekly tooth talks, where I empower the empower the community to make informed decisions regarding their oral health. So I do all kinds of contests, as well as talking about various dental questions that people have related to insurance and all kinds of stuff. And it's very fun and helpful for the community. That's how I also built my practice, but that's how I'm also able to give back. Dentistry is continuously evolving and will always be a lucrative field. So I just want you guys to know that I know that things may seem a little rough right now with the pandemic, but I promise you this is going to be a great decision that you make when you get into dental school. There's so much opportunity out there. You just have to stay focused and make sure that you live like a student. I'm going to show you this video, and then I'm going to give you the last bit of advice here, and then we'll open up for questions, okay?
Doctor, I think you might be sharing the wrong screen. Yeah, you might be sharing the wrong screen. If you don't mind switching over.
Oh, got it. Okay, sorry, my bad. It went to a link. My apologies. How do I get back to it?
No worries.
So what do I do? Stop share and then open the other screen?
Yes.
Okay, sorry about that. Let's see. Oh, there it is. Okay, guys. I'm sorry about that, guys. I'm old, so I don't
worries.
Hear that well. All right, hold on, I'll start over. Give me 1 second. Oh, there we go.
Mask, gloves, soap, scrubs, TikTok, grub, hub, twinks, jocks, bears, cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs, sick beat, cut a rug, Joe Exotic is a bug. Kitty cat, tell me Carol Baskin, where is the husband? Everyone's asking, stimulus check, everybody better cash in, masking gloves, yeah, that's a new fashion. Girl, what did that girl just say, girl? Girl, I don't go to work, I don't leave, I stay, I don't care, I eat and sleep all day, and then I watch TV, that's just the
sorry.
on TV.
I don't know what happened. I'm sorry, guys.
No worries.
I'll start right here, sorry.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap,
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
All right, guys.
Soap, scrubs, mask.
Thank you, guys. Sorry, I'm really bad at technology, so I tried my best. But that's pretty much it with my presentation. I did wanted to give you guys an opportunity to be able to ask questions. But the last component of this is I just wanted to share a few words of advice. I just want you to know that no matter what in your journey, you are enough. And I want you to act like it, to walk like it, and to talk like it. Don't say negative things like, oh, if I get into dental school. Start speaking life to your dreams and they will come to fruition. You just have to make sure that you speak it and then believe it and walk in that. And so when you actually have that opportunity to walk into the doors of your dental school, just know no matter what, I don't care if you get A's on all your tests or if you barely pass by the skin of your teeth, no pun intended, you belong, and make sure that you play the part. While you're a student, whether it is in undergrad or in dental school, just make sure that you live like a student, because dental school is very expensive and you have to think beyond the school component, because you're only in school for 4 more years and you don't want to spend all of your time trying to pay all back that money and can't continue to live your life abundantly once you graduate. But also just make sure that you live a little. And I don't mean that financially. I just mean that enjoy yourself, make friends, make memories, take trips, do nothing sometimes, but just enjoy yourself, celebrate every victory, whether they big or small. And then make sure you take time to learn everything. I think a lot of times we focus on making grades, and sometimes you regurgitate what's being taught to you rather than understanding the caveats and the true meaning of what you're learning so that you can be a better provider and a better student. So just make sure that you take time to learn how to study properly, not just for memory's sake, but for knowledge's sake, so that you can continue to carry that knowledge into practicing dentistry. And then no matter what, whether you pass, fail, exceed, just know it's not the end of the world. If you don't get into dental school the first time, that your chance will come. Continue to speak positive, continue to fight for what you believe in and what you want in life, and it'll come to you. So with that, I'm opening up the floor for questions, but if you want to follow me on social media, I am Dr. Jess B everywhere except Twitter. So, but you can easily find me, and then all of my links are there accordingly. Thank you guys so much for allowing
Fantastic. Fantastic. Yeah, I got to say, thank you so much for that wonderful presentation and for sharing with us a wealth of information and insight. But at this point, I'll go ahead and hand it off to Kathleen so we can go ahead and answer a few questions from the chat.
All right, let's see. Our first question is, what would you say are the pros and cons of working at a corporate office, a private office, and owning your own practice?
That's a loaded question. The pros and cons of working in corporate office is definitely learning how to build speed. In dental school, while you're learning to become a dentist, you're super slow. Like I remember taking 3 hours to do one filling. Like it's literally super slow, whereas a filling takes me 20 minutes now. So corporate dentistry helps to build that speed, and you get to meet a variety of patients from all walks of life. Because some people come in for that $59 special and you never see them again. And then some people have been going there for 10 years. So you meet all kinds of people with various levels of commitment to dentistry and their oral health. And you also gain speed because you're seeing a lot of patients very quickly. With public health, you learn to work with the underserved community. There's a lot of lack of knowledge, I would say, in that community when it comes to dentistry and the importance. And so you have opportunity to learn how to treatment plan, as well as how to educate your patients. That's going to be huge because not everyone believes dentistry is worth all of the stuff that you went to school for. They look at it and say, okay, you want a crown, you can just pull my tooth. But you have to teach them how to understand what is going on and why a crown is more beneficial for them than extraction. So corporate dentistry, or excuse me, public health dentistry definitely taught me how to communicate effectively with patients and learn how to use various analogies to teach them what's going on in their mouth. My biggest analogy is your teeth are like a dish. You eat breakfast, lunch, dinner, snacks on the same dish. And if you don't wash that dish and you leave it overnight, that food hardens and now you got to scrub and scrape it to remove it. That's equivalent to why you would need an SRP. And then they understand, oh, you're not just trying to upcharge me for a deep cleaning. And they have more knowledge moving forward on how to maintain healthy gum tissue and bone. As far as private practice is concerned, there's nothing that beats it. I'm sorry. I've worked, like I said before, corporate dentistry, public health. I've worked in a fufu cosmetic office before. I've worked in an elderly full mouth rehabilitative office that did nothing but implants and, you know, all full mouth cases. I worked in pediatric dentistry. Having a private practice is just like, it's really a beautiful thing for me. It gives me the life that I wanted, what I sought to pursue when I went to dental school. Yes, there's the challenges of running a business, managing staff, dealing with payroll, dealing with, you know, trying to keep your business afloat, especially during this pandemic. But I still would not trade that for the world. Like I can, you know, bring my son to work and have somebody watch him in the back while I'm working, and then we go to lunch. Or, you know, there's just so many things that I can do on my own that I wouldn't be able to do before. I know you guys had a presentation by Dr. Portia James before when she was presenting how she had the baby crib in the back. When I started my practice, my son was 2 years old, but I had his pack and play back there, and then he started going to daycare. He'll be going to kindergarten soon, but we are planning on having more children. And so just to have that flexibility to be able to bring your kid to work, like when I worked as an associate, being a mom, I had to pump because I breastfed my son, and it was hard trying to do that. But having my own office, I wouldn't have to do that. I just could go in the back, take care of my kid, go back and see some patients. It's just gives you the flexibility that you want to have that work-life balance. And if you do it my way without all of the expenses, then it's a lot less headache and you can genuinely enjoy what you're doing and make fun videos too.
I think that was a fantastic response that touched on every base.
Yes, I
Thank you.
agree. Our next question is, what would you recommend as a resource to learn the concepts on starting a private practice?
Can you repeat that question? You said the concepts about starting a private practice?
Yeah, like how do you go about like starting a private practice, and what resources did you use?
So there's a ton of groups out there, especially on Facebook. Facebook is a huge free resource that you can use. There's a group that I'm a part of called the Making of a Dental Startup. Excuse me, but I feel that, again, you just want to make sure that you research. So I started researching how to start a practice like a year or two before I actually even opened my doors. And it takes that long to be able to um, have full understanding of what you want to do, how you want to practice, who you want to hire, what you're looking for, what kind of culture you want. All of those things are critical before you even start like taking out loans or, finding a building. So I would say look at the group, The Makings of a Dental Startup, to help you get an idea of what to do concerning like the build out and selecting chairs and things like that, if that's the route you want to go. But just do research also, just Google, look it up online, or on Dental Town is a good resource to help you to find, various articles about company culture and things like that. Because I think a lot of times people focus on the building and the chairs and just having the patients, but there's a lot more to it than that. It's the marketing, it's the culture that you want to have, it's the community efforts that you want to contribute to, it's making sure that you connect with other people in organized dentistry so that you can have people tell you what they did, and creating that mentorship and things like that. So there's just a lot involved, but I would say start with the dental startup, and then the Makings of a Dental Startup, and then just make sure that you join some of those other dental organizations to help you to have that camaraderie in your journey.
Awesome. Our next question is, in complex cases like the ones that you had presented, how do you decide what to do first?
So I was explaining to you guys before that there's phasing when it comes to treatment. When you're in school, they're teaching you that phase 0 is pain. So you always want to look at pain and infection of a patient before you start jumping into other stuff. You want to abate that first and then start looking at the big picture. I would say that when I first started dentistry, I was a tooth by tooth kind of dentist, and that's like I don't want to say judge people, but it's the worst dentistry you could possibly do, because if you do tooth by tooth and you're not looking at the big grand scheme of things, you're not looking at their bite, you're not looking at their lateral excursive movement, their protrusive movement, when they slide their jaw forward, when they slide their jaw to the left and right, you're going to have to redo a lot of your work. So it's important to check if they have pain and infection, treat that the best you can so that the tooth can be stable, and then look at the big picture and say, what am I trying to accomplish? That's why I had that list of patient goals. The patient if they don't want an implant, or if they do want implants, how are you going to go about that? Looking at, all of those comprehensive components to help you to determine what's next. But phase 0 is pain and infection. Then phase 1 is decay and gum disease. Most patients, I try to have them go get their gums taken care of, because I say that the gum tissue in the bone is the foundation of the dental work. So if I address a cavity, but you still have gum disease, you're still going to lose your teeth. So we get you out of pain, make sure there's no infection. If you don't have that at all, we go straight to cleaning, making sure that the gum tissue is healthy. And then from there, we start restoring. If the patient doesn't have a full mouth case, then I go quadrant or side by side. So I'll say the upper right hand side is the worst. Let's go ahead and work there first. Or if it's the left-hand side, we do that first, and then we go accordingly from there. But that's a good question. You just basically prioritize things using the combination of patient desires, where they are as far as infection and pain, and then what their future needs are and how you want to get to the final result.
That's great to know. Thank you. How long did it take for your practice to start becoming busy?
My question, that's an interesting question, being that my practice started in June of 2019. So I had 3 months really of still trying to figure stuff out, where we were slower. And I would say like September is when we started getting busier, because people are trying to use their benefits at the end of the year. Dentistry across the nation, everyone says it's September, meaning that there's not a lot of patients because people don't want to come to the dentist. But I had the opposite effect. But then the pandemic happened 6 months later. And so before I was even in my first full year, I had to deal with those difficulties. So it's kind of hard to say, but I would say when I reached my 1 year anniversary, that was in June of 2020. That was after all of the shutdowns and stuff. I had a lot of patients, like a backload of patients, and we were booking out like 6 to 8 weeks. And so um, it's kind of hard to say because my situation is a little unique, just like you guys' situation for applying to dental school is unique. But I think that the biggest thing to help build the patient base is word of mouth, and then just being fun and approachable and doing things like using community involvement as your marketing plan and strategy.
What are some strategies you use to get kids to be comfortable going to the dentist?
Oh, that's really good. I do a lot of, well, as far as the kids are concerned, when they're in the office, I do a lot of singing. We play a lot of games. I have oversized everything in the office. So I have like huge toothbrushes. I have big mouth mirrors. I have like this big mouth that they can hold and a little dinosaur that has all these teeth. And so a lot of times when it comes to kids, you want to do tell, show, do. So you tell them what's going to happen, you show them what's going to happen, and then you do what's going to happen. And so if they're apprehensive immediately, what I do is I have them do what I'm going to do to them, to the actual animal, the little dinosaur that I have in the office. So they'll take the mouth mirror or they'll brush his teeth, or if they want to use the air water syringe, I'll have them play with that. And just do a lot of praising, a lot of clapping, singing. We also have televisions in our office. And so that plays a huge role because a lot of kids get to watch what they want to or listen to whatever music they like, or, they love YouTube. So we'll put on YouTube and they'll be fine. And we just, just play it by ear based on that. But most of the kids that come to me, they are really well behaved. The younger babies, of course, they have a lot of ways to go to get more accustomed to the dental office, but it's just getting comfortable with being on their level and connecting it with them that way. Like if they have Spider-Man shoes, like, hey dude, look at your Spider-Man shoes. Oh, I love Spider-Man. What color is his suit? And that kind of thing, just connecting with them with things that they enjoy and going from there.
That's awesome. Do you have any tips for the interview?
Just be yourself. I always tell my mentees, I do a mentorship. I had a mentorship program previously that I kind of closed, but I still mentor. And a lot of I would say majority of my students that applied, they got accepted on the first try. And I always tell them, when you go to your interview, they already liked you on paper. So now all you have to do is be a likable person in person. So don't be, you're going to be nervous. They expect that, but you just have to be yourself. If you start like trying to be someone that you're not, then it makes it hard for them to match you with the paperwork that they liked so well. So just share with them who you are, let them get to know you, let your personality shine through, and more than likely you'll get accepted. People don't interview people they're not interested in. So keep that in mind.
That's very true. What made you choose family dentistry?
So like I said before, I really wanted to be an oral surgeon, but when I was like at the end of my dental school training, I was like, I can't do this. I want to just be out of school. I want a family. Of course I was married 3 years by the time I graduated. So I'm like, I want to have kids. And so when it came to family dentistry, I just realized that I have the best of both worlds. When I did nothing but pediatric dentistry, I was bored because pediatric dentistry, the patient management is the fun part, but the treatment is so boring. You only have like 5 things that you can really do. So I got bored with that. With, family dentistry, I get to see adults still, and the complexities when it comes to the various dental treatments that you can offer, but you still get the fun of the kids. And so it's just really well-rounded. And then on top of that, with me doing oral surgery, I just have like pretty much the full gamut of dentistry that I can do, except molar endo. And so I really enjoy it. It's really amazing. I can't hear you.
Sorry about that.
Oh, okay.
Maybe we have time for one more question.
Okay.
What are some of the challenges of establishing and running a private practice?
The biggest challenge is marketing. People don't know you're there. Another challenge is insurance. A lot of times people get in network with insurance companies to get word. That's how you get patients. You go in network with insurance, they'll tell people that you're a network, you're a preferred provider. They'll send people your way, but insurance companies don't pay you your worth. So like if let's say a procedure costs $1. And if you sign up with certain insurance companies, they'll say, well, I'll only pay you 60 cents for that $1 procedure, but I'll send you patients. Well, a lot of new dentists or new private practice owners will buy into that and go on to network with multiple insurances so that they can build their patient report and get more patients in the door, but then you're doing twice as much work for half the amount of money. So the biggest thing is just delineating what's worth it and what's not. Marketing strategies are the most complicated thing of having a private practice. But like I said before, we're in the age of TikTok and Instagram and Reels and all those things. So you can use that to your advantage, and it's free. Like, you can open an Instagram account for free. You can open a TikTok account for free and just create videos. The content is out there. Create your own, use your own personality, and just that's how you build. But that's the hardest thing. Outside of that, I think a lot of my peers have a hard time with staff. I thank God that for me, when I was as an associate, I met a lot of dental staff members in various work settings, and they were not working for me, but I got a chance to see who they really were behind closed doors that the other doctors that owned the practice didn't get to see. So it put me at an advantage to be able to say, okay, this person has great work ethic. Like, when no one else is around, they're still, respectful, they're still responsible. And so I kind of connected with people that way. When I was done working there, we stayed in touch on Facebook. And then later on, when I opened my practice, I reached out to them like, hey, I'm hiring. And they loved me as a doctor and a dentist. So they came to work for me. So I don't have high turnover. The hardest thing right now is hygiene, but that's another story for a different day. But other than that, everything else, it's just mainly marketing and then just showing the patients what you have.
Great. Thank you so much for your presentation, Dr. Peterkin. We have a lot of thankful comments in the group chat. So thank you.
Awesome. Thank you guys so
That's
much.
awesome.
This is a beautiful thing that you guys are doing. And I'm so glad that you guys have this to be able to gain more exposure to dentistry. Like, I wish I had something like this when I was in my pre-dental years.
Yeah, well, I want to thank, Kathleen, and also I got to thank you, the doctor, for taking the time out of your schedule to help students navigate their paths amidst such a, I guess, turbulent year. But I guess on that note, we'll go ahead and conclude today's session, and we'd like to wish you a productive year. Thank you so much again.
Thank you. You too.